So I'm talking of sustainability. How a child will be born in Gombe State will not only have 5 or the routine immunizations until he's old enough, but even his own younger ones that are coming up, how they will continue to access these services.
In 2015, Nigeria lost about 2,300 under 5-year-olds and 145 women of childbearing age, as stated by a UNICEF report. This makes the country the second largest contributor to the under 5 and maternal mortality rate in the world, despite the progress made over the past 16 years in reducing this.
That time, 1 out of every 6 children in Nigeria would most likely die as a result of any of those common childhood illnesses, particularly vaccine-preventable ones. And we realized that if we could tackle the issue of uptake of immunization, if we could tackle the issue of supply of health workers, if we could tackle the issue of nutrition, then we will be able to make a difference.
When I assumed office as Commissioner of Health in Gombe State, we had a few challenges. First and foremost, we had challenges in terms of human resources for health. Then we have challenges in terms of awareness on malnutrition.
Thousands of these children under age 5 die mostly from preventable causes such as pneumonia, diarrhea, malaria, and malnutrition. The same report shows that 37% of children, or 6 million children of this age, are chronically malnourished with low weight for height, and so are stunted.
Prior to the program or the project by Save the Children, there is no much information within Gombe regarding issues of nutrition, and we have different segments working independently without connecting to each other.
Ever since the establishment of the State Committee for Food and Nutrition, I think there was no year, particular financial year, that a substantial allocation was made to the Food and Nutrition Committee.
Though routine immunization coverage has also increased, disparities exist along the geopolitical regions of the country. Full immunization is lowest in the northwest and northeast regions, with less than 1/10 of children having received all of the main vaccines, and highest in the southeast and southwest regions, and remains almost 3 times higher among urban children and among rural children.
Before the intervention of Save the Children, we have 154 culture equipment that are not functional. But with their support, we went around with technician. The technician was able to correct 46 equipment that has electrical problems.
Basket phone was introduced in 2009. So for the first 3 years, which Gabi, Global Alliance for Vaccine and Immunization, stopped supporting the state, the basket fund run in short of money, which quite okay. The amount we are getting in a month, it cannot cover our work plan.
Underneath these statistics lies the pain of human tragedy for thousands of families. Even more devastating is the knowledge that if essential interventions reached women and babies on time, most of these deaths would have been averted. To address these poor health indices, Nigeria needs to redouble its efforts, put in place and implement new policies, review current strategies, and ensure effective and equitable allocation of resources. This will put Nigeria on track for achieving the Sustainable Development Goal, SDG, for maternal and child survival.
In 2011, we got a grant from Bill and Melinda Gates Foundation to help us carry out advocacy, particularly on immunization, nutrition, as well as human resources for health. The aim of this grant was actually to correct those very wrong indices that we had been having with regards to maternal, newborn and child health in Nigeria.
This advocacy initiative was supported by the Bill and Melinda Gates Foundation, BMGF. It focused on 1. Getting political and public commitment to end preventable child and maternal deaths. 2. Increasing and sustaining health financing and health workforce. And 3. Promoting funding for nutrition activities and mitigating challenges around effective routine immunization coverage.
The discussion about whether we are going this way or another way has actually done in a very collaborative manner with all development partners that are working in the state, other people as well on board, traditional institutions, religious leaders, and Save the Children actually was actually in the forefront, bringing people together, sitting at several meetings in this agency and also at the Ministry of Health to see that people sit down together to conceive the idea of aligning with the national system by the creation of the Primary Healthcare Development Agency.
We've engaged strongly with Save the Children on the issue of improving nutrition at the LGA level. In the course of improving nutrition at the LGA level, the Ministry of Local Government has created a budget line for nutrition at LGA level for all the 14 local governments.
We have been making efforts for so many years to see that a budget line is created for nutrition. But unfortunately, it could not scale throughout those years until 2016 when we had 200 million naira. But with the effort of Save the Children pushing hard to see that things are done for nutrition, because I can recall I collected the commitment of Save the Children and the UNICEF in that very particular year, 2016. I presented it to the government then to see that at least something substantial is earmarked for state as a state counterfunding.
We were sensitized on how to go on advocacy. That is, we were shown the way to go to some other influential people, ask them for what we want in the facilities based on evidence. Save the Children told us that wherever or whatever we are doing, we should have concrete evidences. That is why in most cases, we have to find out data from the facilities and to some extent pictures. We take pictures to present to our stakeholders. And before we go, we have to identify reasonable issues that are concrete. Anybody who comes to any facility we talked about, you can see that there is problem on what we said. And we sit down also to find out who are the stakeholders that we should talk to.
They have trained, they have empowered development committees in 2 LGA, Buji and Kadauri. And those development committees, they are now very, very proactive in terms of, 1, demand creation, strengthening of cold chain, and even the polter tracking. So I think by and large, those development committees, what development committees have done a lot in addressing most of the routine immunization challenges in those 2 LGA of Kadaure and Buji LGA. You can see from the way they have owned the program. So they have owned the program, thereby making them available for advocacy, sensitization.
With the family planning activities, now we use the word childbirth spacing. And Save the Children have been supporting us, especially we had the support from them about the budget line. Initially there was no budget line in Zamfara State, but now with the support of Save the Children we have budget line in the state. And we also have the support for them from Save the Children and Clinton Health Access Initiative supported us on strategic plans, which now the family planning CPR is so high now, from 1% to 5.7% in the state.
In terms of policy making and other changes we've tried to introduce, Save the Children has taken us on a tour to understand that there is a need that the nation as a whole comes together to produce a common platform that everybody will have a level ground to play in terms of the health sector. So they were able to conduct an advocacy, we were able to look into the National Health Act, we interacted with members of the National State House of Assembly, we studied the National Health Act, how we'll be able to operate it in Gombe State specifically. So we're able to work on it, we developed our own structure. Now it's in the Ministry of Justice.
Before the subject finally goes, we'll try to institute a mechanism of strategic exit plan so that we will not create a gap. We are going to do that so that we take complete ownership of this program and sustain it.
May God bless Save the Children, because without Save the Children, we wouldn't have been where we are now. You can see it. We have just registered our WDC with the state government. And this shows that we are not stopping if Save the Children is gone. We are determined to continue.
So what I'm trying to do now is to make sure that all these things they brought to my table, the policies we adopted in trying to address this issue, I now make them sustainable. So I'm talking of sustainability. I'm not only saying bring in the support, no. Bring in the support, I look at it at the State Council on Health and then try to work out with the Department of Planning, Research and Statistics to see how we are going to make these programs sustainable. Once they bring in a policy, we are translating the policy from policy table to implementation, and the implementation down to the clinic where the beneficiaries will now enjoy it, and then we sustain the tempo. That's what we are now doing.
This is the time we can say we need the services of Save the Children, the development partners more than ever before, when we have other challenges surrounding issues of security. The most vulnerable are the women and children. So they need more care more now than before.
I advise Save the Children, one day, one time, if they decide to come back to the state, let them go to the non-CMAM LGAs so that we just circulate all the activities to cover the 34 LGAs, so that one day we just wake up that we don't have any child with severe acute malnutrition in Katsina State.
My prayer here is, if there's any avenue that can make Save the Children International have another point in the state, we will be happy and we will appreciate that.
We would have wanted a stronger collaboration while we are developing strategies for advocacy, when we are prioritizing what actually the state requires in terms of moving one program or the other forward. So maybe these are things that would have been done probably better if we have another chance to do this engagement again.
This project has achieved a lot of things for the last 3 years, but it would never have been possible without the support and participation of CSOs, the government, and a number of stakeholders who were involved in this project. So our partners actually had played a great role in the achievements we have made during the course of the last 3 years. So I really want to say thank you for all those involved, and especially now at the time where we are trying to start a new phase of project for the next 3 years, focusing on Kaduna and nutrition intervention. I would like to call upon all partners to be with us like they did in the last 3 years, so that we can also achieve a lot and lift up children from poverty.